Hi, I'm Jason Howland, and welcome to Speaking of Health, the place to help you learn how to live a longer and healthier life. You know, February is American Heart Month, and joining us today to talk more about the heart and how to stay heart healthy is Dr. John Haley. Dr. Haley is a cardiologist with Mayo Clinic Health System, and he's also assistant professor of medicine at Mayo Clinic College of Medicine in Rochester. Dr. Haley, thanks for joining us today on Speaking of Health.
Thank you, Jason. It's a pleasure to be here.
Well, as I mentioned earlier, February is American Heart Month. So as a cardiologist, you obviously specialize in the heart. Can you tell us a little bit more about it?
Well, the heart is the muscle, it's an organ that's responsible for pumping the blood to the rest of the body so that the tissues get the blood that they need to do their respective jobs. Pretty important organ. It pumps about 2.5 billion times during a patient's lifetime, and my job is to try to keep it pumping.
Well, you hear so much today about heart disease. Can you explain what heart disease is? Is it one disease in particular?
No, a cardiovascular disease refers to a number of different entities that could go wrong with the heart. And actually, if you look worldwide, cardiovascular disease is the leading killer of both men and women. A popular misconception is that men are predisposed to cardiovascular disease and women are protected, but when you actually look at the numbers, it's the number one killer of both men and women. And when you talk about cardiovascular disease, you're referring to the coronary artery disease is what most people think of, and that's when we're talking about coronary artery disease, we're referring to blockages in the heart vessels that supply the blood to the heart. And as you can imagine, as the heart is responsible for pumping the blood to the rest of the body, if the heart doesn't get enough blood, then it's going to have a hard time developing blood to the rest of the body. So we want to keep the arteries to the heart working well so that the pump can work well. But that's one area of heart disease. There's also congestive heart failure, which is when the heart can't pump the blood adequately to keep all the tissues of the body, give them as much blood as they need. The heart has 4 heart valves that, if they don't work properly, can cause problems. There's also heart rhythm problems where the heart may go too fast or too slow or irregular that can cause problems with symptoms and may require treatment. And then there's also congenital heart disease, which are birth defects that we're born with, some of which are apparent immediately after birth, some of which we don't detect until later in life, depending on patient's symptoms. So as you can see, there's a wide number of things that can encompass cardiovascular disease.
Well, let's start with the one that probably most people are familiar with, and what you talked about first is the blood vessels and coronary artery disease. What are some of the symptoms of that?
Well, when you develop a blockage in a heart artery that compromises the blood supply to the heart, that's people develop chest pain, or what we've typically referred to as angina. And the classic description of that is a chest discomfort that can radiate to the jaw, the back of the arm. Now, classically, people have thought of that being as a left-sided chest discomfort or just radiating the left arm. But I've seen patients who develop chest pain on the right arm or right chest or radiates to the right arm. So it's important that people realize that it's a chest pressure or chest pain or an unusual symptom in the chest that should always cause some concern, and just because it's on the right side doesn't mean it's necessarily not coming from the heart. And then you can also develop symptoms such as nausea, vomiting, or sweating if you're developing a heart attack. And actually, women, especially older women, are more likely to develop more of these atypical symptoms such as shortness of breath or nausea or vomiting rather than the classic chest pain. So anybody who's having those type of symptoms should pursue evaluation to make sure they're not experiencing a blockage in an artery or what we call a heart attack.
And what is blocking those arteries?
Typically, it's plaque, what we call plaque, or which is develops over the course of our lifetime, and can, if it progresses significantly enough, it can start to block the artery and compromise the blood supply to the heart. And that plaque, a misconception is that something that develops later in life. But really, plaque development can start as early as our 20s. When we've done autopsies of unfortunate young people who have died in traffic accidents or in the military, when you do an autopsy and look at their heart arteries, the initial development of plaque formation has already occurred, even at their young age. So it's important for all of us, young and old, to be aware of risk factors for developing plaque in arteries and trying to prevent that now so we don't develop complications later in life.
And what are some of those risk factors?
There are some things that we can't do something about, and there's some that we can. Family history certainly plays a role in your risk of developing coronary disease. So if you have a family history as such, it's important to be aware of that and be even more aggressive about treating your other risk factors. Then, of course, aging is something that we can't do anything about as much as we'd like to. And so those are the risk factors that we really can't adjust, but there are some things that we can do. The most important thing is to not smoke, and if you do smoke, to try to work on stopping smoking, because that certainly contributes to the development of blockages in the heart arteries as well as all arteries. Similarly, if you have high blood pressure, it should be treated. If we treat the blood pressure, that can help develop problems down the line. And just as importantly, if you haven't had your blood pressure checked, please make sure to get it checked, because there's a number of people who have high blood pressure who aren't aware of the fact that they don't even know that they have high blood pressure. Similarly, if you have diabetes, it should be treated aggressively to help prevent the development of plaque in the arteries. And then if you have high cholesterol, it's important to treat that and get your cholesterol to goal, as keeping a low cholesterol can help prevent the development of plaque in the heart arteries.
Well, let's move on to abnormal heart rhythms, abnormal heartbeats. Can you talk a little bit about that?
Sure. Sometimes people develop symptoms of a fluttering sensation or a skip beat, or sometimes they'll say a flip-flop, and that can sometimes be an abnormal heart rhythm. And the key to treating that oftentimes is trying to determine what is causing that symptom. There's a number of different rhythm problems, the majority of which are benign or easily treated. But the key to treating that is to determine what the rhythm is. Is it due to just an abnormal extra heartbeat that we all frequently will develop, but some people are aware of them and some people are not? Sometimes we can develop faster heart rhythms coming from the top chambers of the heart, what we call supraventricular tachycardias, that can be treated with medications to slow the heart rate down or to prevent that rhythm from occurring. And in some cases, there's procedures that we can do to eliminate that rhythm from occurring. Then there's other rhythms that can come from the bottom of the chambers that are a little more dangerous, that we like to be more aggressive with, called ventricular tachycardia, that require a little more aggressive treatment. So the first part of evaluating or treating somebody is trying to determine what the rhythm is that's causing this symptom, and then determining if it requires treatment or not. In addition, sometimes people develop a slow heart rate that can cause dizziness or lightheadedness, and they may require some medication adjustment or sometimes a pacemaker.
And with these abnormal heartbeats, does it really depend on the circumstance whether or not a patient can actually feel or tell that they're having that abnormal heartbeat, or will everyone always tell if you have an abnormal heartbeat?
No, there are sometimes, we know that sometimes patients may have an abnormal heart rhythm, and sometimes they feel it and sometimes they don't. So sometimes you may have an abnormal heart rhythm and just not be aware of it. And whether or not that's, and again, in many cases, if you're not experiencing any symptoms and it's a benign rhythm, that's not an area of concern. So it really depends. A lot of times it depends on what the rhythm is and what symptoms that's causing. We'll oftentimes determine how we treat it.
Okay. What about heart defects? You mentioned those earlier. What are heart defects?
Heart defects are when the heart develops in the uterus, it goes through a very complex development process, and it always amazes me that errors don't happen more frequently than they do. It's just amazing. But occasionally, in the process of development, something doesn't develop properly, and so that leads to an abnormality of the heart. And when people are born, sometimes that abnormality is immediately apparent because it causes problems that need to be treated immediately to allow the baby to live. Then there are others that are less dangerous and we don't necessarily detect until later in life, and how we treat those defects depends really a lot of times both on if the patient's experiencing symptoms as well as what problems we think that defect is causing.
So overall, what can heart disease lead to? Obviously, most people would associate it with a heart attack, but it's not just heart attacks, right?
It's not just heart attacks, although that's certainly one of the major problems, but also over the time it can develop, people can develop, if you have untreated high blood pressure or if you have had heart attacks, you can develop congestive heart failure where the pump does not work quite as well. In addition, sometimes if the heart function is not normal, you can be predisposed to some of those heart rhythm problems we discussed earlier.
So what are some of the typical tests that patients can have done to determine if they suffer from heart disease?
Well, I think one of the most important things is to just have a good history and physical with a physician, to sit down and talk to about what symptoms you're experiencing and then listening to the heart. And that goes a long way to determining what we think, what problems the patient may have and what needs to be done. Oftentimes in the office we'll do something along the lines of an electrocardiogram or an EKG to look at what the heart rhythm is and to see if there's any evidence that they've had previous heart attacks. So it's just an electrical tracing of the heart's rhythm, but we can also use it to determine if we think that there's ever been a previous heart attack or if there's evidence that there's been high blood pressure or that the heart's working a little harder.
And an echocardiogram as well you can use?
Yes, and that's a fantastic tool that we use it's an ultrasound of the heart. And it allows us to look at how the heart functions, how well the pump is working, if you will. In addition, as we discussed earlier, the heart does have 4 heart valves, and that test allows us to look at the valves and determining how well those valves are working. Are they leaking, or are they not opening up as they should? The test can also give us an idea of if there's ever been previous heart attack. So that's a great tool to help us look at people's hearts.
So someone's been diagnosed with heart disease. How do you and the patient, how do you, the cardiologist, and the patient work together to treat that heart disease?
Well, specifically referring to coronary disease, I think the most important thing is to work on treating the risk factors for heart disease. In addition, working to make sure they're on the right medications for whatever condition they may have, and adjusting those medications to eliminate their symptoms as best as we can.
And any words of advice for folks? Obviously, lifestyle changes like quitting smoking and diet, those kind of things, obviously do wonders to help as well, right?
Well, I'm a very strong proponent of exercise, and I talk to all my patients that exercise, I really think, is the best medicine for all of us. And strongly encourage all my patients to try to exercise for moderate duration for about 30 minutes a day. Exercise, it reduces blood pressure, it can reduce your cholesterol, it reduces your weight, it can reduce stress, and it really comes at no cost other than time. So that's the cornerstone, I think, of all treatment. Then, as you said, we want to talk about the risk factors and getting the blood pressure and the cholesterol controlled, treating the diabetes, and stopping smoking. And then we also want everybody to try to eat a heart-healthy diet, which encompasses a diet high in fruits and vegetables, low in fats and saturated fats and fried foods. And I think if we can get everybody doing that, they will be doing all that they can to reduce their risk of developing heart disease later in life.
You know, it's interesting that you would talk about exercise being medicine because the heart is a muscle, and you want that muscle to work just like you would want to work out any other muscle in the body, right?
Absolutely, and I always tell patients, if you don't use it, it's not going to work as well. So the more you use it and get out there and take it out for a spin, if you will, the better it will work.
All right, fantastic. Well, unfortunately, that's all the time we have, but a great topic and a great speaker. I'd like to thank Dr. John Haley, a cardiologist with Mayo Clinic Health System and also assistant professor at Mayo Clinic College of Medicine in Rochester, for joining us today on Speaking of Health. Great.
Thank you, Jason. It's been a pleasure.
Have a great day, everyone, and be healthy.